Every 45 minutes, at least one man dies from prostate cancer. One in every 8 men will be diagnosed with prostate cancer throughout their lifetime. Now, based on these statistics alone, we understand exactly why it is such a touchy subject, such a grim subject amongst men. Welcome to Wellness Men Mastery, and today to help us understand prostate health and help eliminate some of our misconceptions or fears surrounding the subject is one of the world's most decorated and celebrated and revered urologists, Professor William Aiken. Professor, welcome to Wellness Men Mastery, and how are you doing?
Thank you, Kyle. Happy New Year to you and your listeners, and I'm doing well, thanks.
Thank you, and thank you for joining us. Now, Professor, first question, right? What is prostate cancer and how does it affect a man's health?
Okay, so prostate cancer is essentially a malignant process that occurs in the prostate gland. A malignancy is an abnormal growth that grows in an excessive and abnormal manner without the usual checks, and it has the ability to metastasize or spread to different parts of the body, and that usually is what ultimately kills the patient. When that process arises in the prostate gland, you have prostate cancer. Now, the prostate gland is one of the male accessory organs of reproduction. The primary organs are the penis and the testes. The penis is an organ of copulation or sex or coitus, and the testes produce the sperm cells that fertilize the female egg. But we do have accessory organs that play a supportive role in male reproduction, and the prostate gland is one such organ. So the prostate gland, it makes up 20% of the semen. So when a man ejaculates, 20% of that semen comes from the prostate gland. 70% comes from another gland, and only 5 to 10% comes from the testicles. So in that 20%, you have some very important enzymes and nutrients. And one of the important enzymes is an enzyme called prostate-specific antigen. And that enzyme is responsible for keeping semen in a liquid state that allows it to flow freely in the female genital tract. Okay. The other function of the prostate is a muscular one. So during ejaculation and orgasm, the prostate gland contracts and helps in obliterating the communication between the bladder and the urine passage. So it helps to prevent retrograde ejaculation. Now, the prostate gland is located deep in the bony pelvis. It is immediately below the bladder, and the urine passage runs directly through it. And so whenever there are abnormalities of the prostate gland, whether enlargement due to benign or non-cancerous disease, or whether due to prostate cancer, it may affect the urine passage and impair a man's ability to pass urine. Okay, so that's a long-winded answer, but that's what the prostate gland is. We have spoke about what it does and the process of cancer arising in it.
Appreciate that response so much, and of course I have learned a lot, as you may have witnessed from my expression, and I'm sure our viewers have also learned quite a bit. Now I suppose you touched on it in that response, but what are the causes of prostate cancer? What are the direct causes of prostate cancer?
So a cancer arises from a change in the genetic makeup of a cell, and that change results in an abnormal growth of the cells, such that they grow in an excessive and uncontrolled manner. We do not know directly what causes prostate cancer, but we know that there are certain associations. We know that prostate cancer is more common in men of African ancestry. So there may be lifestyle or genetic or cultural factors in men of African ancestry that put them at increased risk. We know that it runs in families. And again, the fact that it runs in families means that there is a hereditary component to prostate cancer. And we know that it is a disease of aging men. So younger men tend not to get prostate cancer, but after the age of 40 years, the incidence of prostate cancer increases with age. So those are the established risk factors: African ancestry, family history, and age. It is not just a family history of prostate cancer that increases a man's risk, but also a family history of other cancers such as breast cancer, some types of colon cancer, even pancreatic cancer may increase a man's risk of getting prostate cancer. So a family history of prostate cancer and some other cancers also is a risk factor for prostate cancer. Because all the risk factors that we have mentioned so far are what we call non-modifiable risk factors. You cannot change your age, you cannot change your race, and you cannot change your family history. So things would seem pretty grim when it comes to prostate cancer, but there are some modifiable risk factors that may not be as strong as the ones we have mentioned, but nevertheless may play a role in prostate cancer. And this includes diet. So a diet rich in red meat, animal fat, processed meats, dairy products. These are all known to be associated with an increased risk of prostate cancer. Obesity is also associated with a worse outcome when men have prostate cancer. So these are some of the modifiable risk factors.
How prevalent is prostate cancer in Jamaica compared to other countries?
So prostate cancer is the most common cancer in the Caribbean as well as Jamaica, and it is the most common cause of cancer-related deaths. The last statistic demonstrated that 78 men per 100,000 per year were at risk of developing prostate cancer. And we do know that based on a study done many years ago, that the risk of death is 53.9 per 100,000 per year. But these figures may have changed, but those are the latest figures that we have.
How does a man test for prostate cancer?
Okay, so a man tests for prostate cancer by doing two things. One is a blood test. We mentioned earlier the prostate-specific antigen, which was said was present in semen and arose from the prostate. Well, that same prostate-specific antigen, or PSA for short, whenever there is any abnormality of the prostate, it leaks into the bloodstream in increased quantities. And so a simple blood test to test the level of PSA in the blood is one of the tests that we can do to check on the health of the prostate. So that's called the prostate-specific antigen blood test. The other test is a test to examine the surface and the consistency of the prostate, and that's the digital rectal exam. And that's done by the doctor inserting his or her gloved and lubricated finger into the anus to feel the surface and consistency of the prostate. A normal prostate feels like the tip of your nose. It has a firm, rubbery consistency. What the doctor is looking for is whether there are any areas of hardness or loss of movement of the prostate. And this will lead us to suspect that there could be cancer arising within the prostate. So those are the two tests. If either one of those tests is abnormal or both are abnormal, then we'll go on to doing what is called a biopsy, where we take a pinch of tissue from the prostate and we send it to the laboratory for special staining and special preparation, and the pathologist will examine the tissue under the microscope to determine whether cancer is present or not. If cancer is present, she will say, or he will say, what the extent of it is in terms of the number of cores that are involved and what the grade of the cancer is. The grade gives us an idea of the aggressiveness of the cancer.